All right, good afternoon. My name is Jenna Elise, and this is my submission for my health assessment and physical final practicum. It's on an adult male patient. Um, First, I'm going to introduce myself to the patient, then I'll wash my hands. So, my name is Jenna Elise Eisworth. I'm going to be your advanced practice nurse today. I'm going to be completing a full head to toe assessment on you. Is that okay?
Yep.
All right. I'm going to wash my hands. Can you tell me your name and date of birth?
Evan Eisworth and 12/23/1991.
Okay. Can you tell me the date today?
July 28th, 2019.
Okay. And do you know the day of the week?
It's Sunday.
And can you tell me the President of the United States?
Donald Trump.
Right. So first I'm going to begin my exam on your head and your neck. So to begin this exam, I'm going to just inspect your external structures, see if anything sticks out, and then I'm just going to palpate your skull and feel for any irregularities. Do you have any pain in your face or neck today?
Nope.
No. Okay. Next, I'm going to palpate your sinuses and your lymph nodes. So to begin, I'll be pushing underneath your cheeks to feel for any swelling. Do you have seasonal allergies?
No, not really.
Any pain, let me know, okay?
Okay.
Underneath your chin. Okay. And at your clavicles. Okay. Next, I'm going to palpate your thyroid. So if you could look directly at me. You have a large Adam's apple, so this will be good. First, I'm going to move your Adam's apple slightly to the right. I'm going to have you swallow. Okay. I'm going to move it now to the left. I'm going to have you swallow. Okay. Very good. Next, I will check your ears and your hearing. So to begin, I'm just going to look at your external ear structures. Do you have any ear pain today?
No.
Okay. So if I had an ophthalmoscope, which is a device that is used to examine the internal ear, I would hold the ophthalmoscope with the handle upwards, insert the piece that provides vision so I can see through it, a magnifying glass. It will look at your tympanic membrane. I would want to visualize that, which is your eardrum. I want to make sure that it's pearly white. I'll also look at any extras, if you have extra sebum or anything like that, earwax. Same over here. Insert the speculum or the ophthalmoscope into your ear. I would hold up your earlobe, place the vision piece into your ear, look into your ear canal to visualize tympanic membrane. Do you have any vision or any issues with your hearing?
No.
Decreased hearing. Okay. I'm going to perform a couple hearing tests today. It involves a tool that creates vibration. So what I'm going to do first is make the tool vibrate. I'll place it on your skull and let me know when you stop feeling or hearing the vibration. You'll feel it in your skull and then you'll also hear it bilateral ears. Okay.
Okay.
So you can close your eyes and then you can just raise your hand when you stop hearing it. Okay. 10 seconds. Next, I'm going to do the same thing. I'm going to make it vibrate, place it on the bone behind your ear. I'll have you raise your hand when you don't feel that vibration or hear that vibration. And I will place this vibratory piece on the outside of your ear in the air, free space, and you'll hear that vibration. And then raise your hand when you stop hearing that vibration. Okay? I'm going to test your right ear now. So same deal. Very good. Next, I'll take a look at your eyes. Do you have wear glasses or have vision problems?
I wear glasses for watching TV, driving, and if I'm in a meeting and the
Okay.
text is far away.
Okay. Do you see the eye doctor every year?
Mhm.
Very good. You don't need your correctional lenses for reading
No.
in general? Okay, very good. So I'm going to have you look straight at me. First, I'm going to check your pupils with a light. So I'm looking to make sure that the pupil that I place the light on will constrict, along with the opposite pupil will constrict. The eyes operate together. So, good. Next, we'll do some vision testing. So first, I'm going to give you this spoon to cover your eye. You're going to cover right eye first, then left eye,
Okay.
Or whatever you're more comfortable with. I'll have you hold this at an arm's distance, and can you read the line, the smallest line that you can see? So you ideally want to
LTFPH.
switch.
LTFPH.
Okay, very good. I'll have you keep that spoon. I'm going to check your peripheral vision. So hold the spoon against right or left eye, whatever one you prefer first. I'm going to wiggle my fingers, and I'm going to have you say now when you see my fingers into your visual field.
Now. 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 Now.
That's it.
Now. 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 Now.
Very good. So usually the last exam for vision would be I would have an otoscope, so that views the internal structure of your eye. Right now, sitting here without an otoscope, I'm looking for the corneal light reflex, which is a spot on your eye that shows a light, and it's symmetrical on both sides, which I do see. And if I had an otoscope, I would be able to view the internal structure of your eye, and I would look for the red light reflex and any sort of vasculature that would stand out as abnormal. Okay, so now I'm going to perform some sensory and cranial nerve testing, which are usually done to rule out any sort of issue or deficiency or deficit that would occur with a stroke. I would foresee these would all be normal for you, but I'm going to check them anyway. So first, I already did a couple with the eye testing. I'm going to test your sense of smell.
Okay.
So if you could close your eyes and close your right nostril. I'm going to put something underneath your left nostril, and you're going to tell me what you smell.
Smells like peppermint.
Occlude your, and tell me what you smell.
Smells like lavender.
So these are just scent sticks, peppermint, and lavender. If I had also had the ophthalmoscope, I could look into your nose with the camera and view your turbinates and see if you had a deviated septum and make sure all of those things were intact. But we don't have a medical office here, so that is what I would do. Next part of your cranial nerve assessment, I'm gonna check smile. So can you see? Good. You have good dentition. You go to the dentist.
Yep.
Okay. Can you raise your eyebrows? Wiggle your nose. Okay. Can you puff out your cheeks? Can you relax? Stick your tongue out and push your tongue against your cheek. Good. Next, I'm going to check your gag reflex. I'm not going to actually gag you, but I will just have you open your mouth for me. Stick out your tongue. Good. Say ah.
Ah.
Say it again.
Ah.
Perfect. Now bite down on this piece. I'm going to try and pull this away from you. Don't let me do it. Also, in a stroke patient, we would check like a corneal reflex, which place cotton on a cornea. I'm not going to do that to you because that could cause a corneal abrasion.
Okay.
So next, I'm going to have you kind of close your eyes. I'm gonna take a wisp of cotton to your forehead, cheek, and chin, and you're gonna tell me where I am. Okay?
Okay. Cheek, forehead, chin, cheek, forehead, cheek, cheek, chin.
Next, I'm gonna have you push your head against my hand. Good. This side. Shrug your shoulders for me against my hands. Big shrug. Okay, very good. Equal strength everywhere. Okay. Next, real quick before I move down to your arms, things like that, I'm going to listen to your neck, listen to your carotid artery. So if you could take a deep breath in for me, hold your breath. And I'm listening for a breathe. It's just a pulse. Breathe, exhale. Breath in. Okay, very good. Okay, so next I'm going to move to sensory testing of your arms.
Okay.
Also, this is to detect any sort of irregularities or changes in a stroke patient for the most part. So if you could real quick, I'm going to move you through various arm movements real quick. So this is to test cerebellum. So put your hands on your thighs, flip them up and down for me. Good. Can you squeeze my hands? Squeeze, squeeze, squeeze. Good. Bend your arms up, like keep your elbows in and bend up. Push down and pull up. Good. Any pain? Nope. Okay. So next I'm gonna check the sensory piece. That was motor. This is sensory now. So I'm gonna take a soft side and a sharp side.
Okay.
You're gonna tell me if you feel sharp or soft.
Okay. Sharp, soft, 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 sharp, soft, sharp, soft, sharp, 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 soft, sharp, soft, sharp.
Okay, very good. Next I'm gonna take the same two Q-tips. It's going to be either 2 or 1. I'm going to move my way down your right arm and then move on to your left arm.
Okay.
You have to tell me if you feel 2 points of contact or 1 point of contact. Just say 2 or 1.
Okay. 2. 2. 1. 2. 2. 1. 2. 1. 2. 1. 1. 2.
Move on to your left arm. So the higher up on your arm, the less sensation we have. Your hands are very sensitive. We use them very often. So our sense of feel is very special in our hands. On your arms, the farther apart that they are, that you don't need them to be as far apart on your hands. So
Okay.
here we go. Move over here.
2. 1. 1. 1. 2. 2. 1. 1. 1. 2. 2. 1. 2. 2.
Next, I'm going to check, flip your hands up. I'm going to see if you're able to detect what I'm writing in your hand.
Okay.
So in your right hand, I'm going to write a number, 1 through 9. And on your left hand, I'll write a letter, A through Z.
Okay.
Ready?
2. Feet.
Correct. Next, I'm going to check if you are aware of where your finger is in space. So tell me which direction I'm moving your finger.
Up. Down. Side. Side.
Next, I'll place 2 objects in your hand. They're going to be different in each hand. So
Okay.
first, I'll start with your left hand. You're going to tell me what object that is, and then I'll move to your right hand. What object is that?
It was like a coin.
And what's in your right hand?
Bottle cap.
Very good. Okay, so I guess I could test the points on your legs now that we're here, so I can do pinpricks on your legs. It's going to be sharp or soft, and then same deal, 2 or 1.
Okay.
Ready?
Okay. Sharp, 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 soft, sharp, sharp, soft, sharp, sharp,
That hurt.
soft, soft, sharp, 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 soft, sharp, 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 soft.
Very good. Okay. Next, 2 or 1.
Okay. 2, 2, 1, 2, 1, 1, 1, 2.
2 or 1.
2, 1, 1, 2, 2, 1, 2, 1, 1, 1, 2.
Very good. All right. Next, I'm going to check your sense of vibration in your knuckle.
Okay.
So I'll vibrate the tuning fork, place it on the knuckle of your hand. Once I enclose the tuning fork and stop the vibration, tell me when you feel it stopped.
Okay.
Okay? Close your eyes.
Stop.
Mhm.
Stop.
Okay. Let me think if there's anything else we need to hit on your hands. No, I think we're pretty good. You have any questions so far?
Nope.
No. Okay. Next, I'm gonna assess the interior side of your chest. So I'll have you take your shirt off. Apologize for that. So I'm just gonna have you first move your arms up like this. I'm just assessing for anything that would stick out. And then same on your hips. Good. Okay, you can relax. First, I'm just inspecting your interior chest wall. See if there's any abnormalities, which I don't see. I'm going to palpate your ribs for tenderness and to find the spaces between your ribs. Next, I'm going to percuss your lung field, so I'm going to strike my finger on the spaces between your bone and where your lung tissue would be. Ready? In a female assessment, this piece might be a little different because of breast tissue. Ooh, sorry. Next, I'm going to listen to your lungs. So I'll have you take a few deep breaths
Okay.
as I listen. Okay? Deep breath in. Deep breath. Okay, good. Next, I'll do your cardiac assessment. So that will include vascular as well in your hands.
Okay.
So to start, I'll look at your anterior chest to make sure there's I don't see anything like glaring at me that your chest isn't pounding or anything like that. Do you ever have chest pain, shortness of breath? Okay. So first, I'm going to palpate your external structures of the cardiac assessment, which include the left clavicle. I will move my way between multiple ribs, in between the first, second, third, fourth, fifth rib space. I'm going to palpate right here at the point of maximum impulse, which I can feel. You take a deep breath in, exhale, and hold it out. Good, breathe. And the left side of the sternum. Next, I'm going to listen to your heart sounds. I'm going to be listening to 4 points of the heart. 1 point being this left fifth intercostal space, midclavicular line. That is where the mitral valve is heard. I'm going to move over laterally, which is where, and upwards, which is where the pulmonic valve is heard. Here is the left sternal border, second intercostal space is where the tricuspid valve is heard, and then the right sternal border, second intercostal space is where the aortic valve is heard. So I'll start down here. Next, I'm just going to have you lean forward into my stethoscope. Good. Relax. Okay. Any questions so far?
Nope.
I'm going to have you turn around. So you can face this way. I'm going to do a posterior thorax assessment, posterior chest assessment. I'm going to do some listening tests, so I'll have you voice out some things that I tell you,
Okay.
and I'll listen to what's going on here as well as measuring your diaphragm. So if you could relax your shoulders for me. Just going to take a look at your external structures, your ribs, no issues. Next, I'm going to assess your equal symmetrical inhalation and expansion of the chest. So if you could take a deep breath in for me. Exhale, good. Deep breath in. Exhale. Very good. Next, I'm going to move down your back and have you say the word 99. The moment that I have my hand on your back, you'll say the word, and I'll move my way down.
Okay.
Ready? Go.
99, 99, 99, 99, 99.
And then the last kind of breathing test that doesn't involve a stethoscope. What I'm going to have you do is take a deep breath in, hold your breath. I'll explain the commands and then I'll have you do it. Take a deep breath in, hold your breath. I'm going to percuss or make that tapping feeling on my finger.
Okay.
And measure your diaphragm, which is the large muscle that is responsible for lifting your chest, your rib cage up when you breathe in. So I will measure it here. Ready? Deep breath in. Exhale. Hold it out. Okay. Relax. Now this time what I'm going to have you do is take a deep breath in and hold it. Deep breath in. Hold it. Okay. All right. You can breathe. I'm going to measure that. Good. It's about 3 centimeters, which is normal. Okay. So next I'm just going to percuss the posterior lungs. You can just relax. You can breathe normal. Next, I'll listen to your lungs. I'll have you take multiple deep breaths. I'll move down your left side to the right, down the right, back to the left. Okay?
Yep.
Deep breath in. Exhale. Good. So now this part of the exam will be the voice command. So I'll have you say 3 different things. And from there, I will listen on your back. Okay? So the first thing I'm going to have you do is say E. I'm not going to hear that. I expect not to hear that because you don't have COPD. So same thing. I'll move my stethoscope down and across your chest, or the back of your lungs. So ready?
Yep.
Go ahead.
E.
Good. The next test I'm going to have you perform is I'm going to have you say 1, 2, 3 out loud. Go.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. This time I'm going to have you whisper 1, 2, 3.
Okay.
Ready? Go. Okay. Very good. Okay. So flip back to me. A couple things that I didn't do. I'm just going to palpate your pulses on your wrist.
Okay.
And I'm going to perform a small test on your hands to assess vascular. It's your owner. Okay. So I'm going to occlude your radial artery. Squeeze your hand. And open your hand. Release it and it returns in the color. So I'll occlude here. Good. Can we do that again? I'm sorry.
Yep.
Push down. Good. Open. Good. It returns. Here. Close. Open. And it returns. close your hand, and open, and it returns. Okay. I'm just going to feel your pulses behind your knee, so it's
Okay.
popliteal here. And then posterior tib. And your pedals. So this side too. Posterior tib. And your pedal. Okay. I'm trying to think if there's anything else I need you to do before I lay you down. I don't think so. Okay, so you can lay with your back on the exam table here. I'm going to perform an abdominal assessment now. So I'm just first to begin the abdominal assessment, I'm just going to look at your abdomen, see if there's any sort of deformities, and before I listen to your belly, I'm going to have you cough. So can you give me a big cough? Good. I don't see a hernia. Next, I'm going to listen to your belly. Are you hungry?
Why?
I don't know. It's a yes.
Here's some rumbles.
Okay, next I'm going to listen to your abdominal aorta. Belly's loud. Listen to your renal artery. And your right renal artery. So loud. Okay, next I'm going to listen to your iliac artery. Very good. For purposes of this exam, I'm not going to palpate your femoral or listen to your femoral arteries for privacy. Okay, so next I'm going to percuss your abdomen. I'm going to do that loud clicking sound against my finger, and I should hear hollow sounds. So next I'm going to find your liver. It's on the right side of your body here. I'm going to do that loud tapping sound again. I'm going to move my way up towards your rib cage till that sound changes, and then I'm going to do the same thing. I'll mark it, and I'll do the same thing all the way down. Okay. So right about here. Here. So here to here. Measure that. And your liver is about 8 centimeters, which is normal, 6 to 12. Okay, next I'm gonna listen to your heart in the left lateral position. So I'm gonna have you hike your knees up, turn your hips slightly to the side. Good. And I'm gonna listen over here to the left side of your heart. And I don't hear any adventitious heart sounds. So that's good. You're not in heart failure or you don't have a large left ventricle. So that's good. All right. Next, I'm going to percuss your spleen, which is on the left side. So you're going to actually hike your hips slightly to me. Good. So I'll do that same tapping noise. It's going to be between the 8th and 11th rib. So there. Okay. You can relax. Next, I'm just going to palpate your belly if for pain or for masses, and then I'm going to feel your abdominal aorta for size.
Okay.
Any pain?
Nope.
Ticklishness. Okay. So here in between your belly button and your rib cage is where I can feel your abdominal aorta. Yours is tiny. It's only about 2 centimeters, which would be 2 finger breadths wide. Yours is about 2 centimeters. Before I have you sit up, I'm going to examine your breast and axilla for enlarged lymph nodes. Males can get breast cancer. It happens like 1% of the time, but it can happen. Palpate around your areola here for masses and into your armpit. I know you're ticklish. And I don't feel any enlarged lymph nodes. This time we'll come over this way. Before I have you stand up, I'm going to perform a couple leg tests. I'm going to test your hip and knee mobility. So, and if you have any neck pain with this, let me know.
Okay.
So bend your knee. I'm going to flip it out internally and extend. Try it again. And extend. Good. Same with this leg. Bend your knee. Any pain?
Nope.
Okay. Next, I'm going to check equal strength of your legs and feet. So can you push against my hands? Good. Pull back. Push up. Legs up. And push your legs down. Okay. All right. I guess from here I'll have you sit up. I already checked your pulse in your feet. Okay, I'll have you sit up. Before you put your shirt on, I'll have you stand up. I'm going to check your spine.
Okay.
So if you could turn around here. I already checked the posterior spine. It looks good. So can you bend forward for me? I'm going to check for curvature or scoliosis. And you have a nice straight spine. Okay, very good. Relax. You put your shirt on. The last couple things I have for you are balance exercises to assess gait or any sort of balance problems you may have. So first, actually, I'm going to have you sit here for a minute. Can you scrape your heel to your toe? Good. Opposite. Good. I'm going to check your reflexes. So I'll be using this
Okay.
piece here. So first I'll assess your brachial reflexes. Good. Over here. I'm going to do your radials. So I'm just going to strike. I'll check your patellars. There's too. I'm gonna bend your arm. I'm gonna check tricep reflex. Okay. More over here. Good. And then I'm gonna check your Achilles.
Okay.
So if you could try and relax as much as you can, I'm just gonna strike this at the base of your Achilles. If I was unable to get you to make these reflexes, what I would have you do would be clench your teeth, or if you could, hold your hands in prayer position and squeeze them. Close your eyes. Relax. Okay. Next, I'm going to check your plantar reflex. I'm going to rule out if there's presence of a Babinski reflex, which again is tested in stroke patients to make sure they have retained some sensory reflexes. So here I'm going to scrape my thumb across the side of your foot and across to your toes. Ready? No reaction's fine. Also looking to make sure that you don't fan your toes out. That's ready? Good. Okay. Let's see. Okay, so you can stand up and we'll do the gait stuff. So first thing I'm gonna have you do is stand straight with your feet together, hands kind of relax and close your eyes. Good, now put your arms out. Good, relax. Next thing I'm gonna have you do is you can heel toe walk to me, and then you can do it backwards. Good. Do it backwards. Okay. Walk to me on your toes. Turn around and walk on your heels. Good. What else is there? Stand on your left foot and hop in place. Switch. Very good. You can relax. So I believe that concludes our full assessment. Do you have any questions for me?
No.
All right. Thank you so much for doing this for me. I appreciate you. Good job. All right. That concludes my full head-to-toe assessment on this patient, and that'll be that. I will document my findings in the H&P and submit it along with this video shortly. Thank you very much.